You're listening to Happy Healthy Hormones with Dr. Chris. Are you tired of the short-term patch to your health problems? Is avoiding medications and surgeries important to you? If you answered yes, then your prayers have been answered. Dr. Chris has been helping people transform their health for over a decade. He's a world-renowned health expert who specializes in holistic health. He's a professional speaker, chiropractor, and international best-selling author. It's his mission to help you reach your full God-given potential through holistic health and healing. Get ready to be inspired and transformed. Here's your host, Dr. Chris.
Hello and welcome everyone. This is the show where disease takes a dive and people come to thrive. So we've got a short amount of time today to get through a ton of stuff, and this is a really important area because there are so many people out there that are just suffering with pain, back pain, neck pain, arm, shoulder, hips, you name it, and a lot of times they don't know what to do, and we want to give you some quick things you can do today to start to get some relief. And although it's not the fix, it's at least going to help you get through the day a little bit easier until you can get to that point where you can get to the fix, get to the cause of the problem, and start to get your body healing from the inside out. And so I want to talk to you today about the 8 best muscle relaxers you can use. And I'm not talking about the artificial kind, because those artificial ones, the prescriptions, the medications, they will destroy your body, they will wreck you. But I'm talking about some natural things you can do. But if you've ever taken a prescription muscle relaxer or thought about taking one, you might have looked at the side effects of those medications. Maybe you haven't. The name alone probably makes you think that muscle relaxers are actually helpful and harmless and make you feel nice and relaxed and good. But think twice, because synthetic muscle relaxers, unlike homemade ones that I'm going to talk about today, are actually both highly addictive and dangerous. So people are talking about the opioid crisis. Man, you can't just look at just the painkillers. You got to look at the muscle relaxers too. It's one of the most underrated dangers when it comes to dealing with pain. And they're not just used as they're prescribed or intended, they even create bigger issues also. And so the problem with a typical prescription or even the over-the-counter muscle relaxer is that they don't heal the body. They don't resolve the problem. They just shut off the communication between your nervous system and your brain so you don't feel the pain. However, the shutoff isn't localized to just the painful spasmed muscle, but the entire body. And it's affected in ways that are not intended or very desirable as well. So you might want to take a muscle relaxer for pain in your back, your arms, your legs, the neck. But again, all these areas of your body are going to be affected. You might fall asleep quickly and easily after taking a muscle relaxer, but how do you feel when you wake up, right? It's not uncommon to physically feel like you got hit by a truck. And you likely experience brain fog as well. How are you supposed to operate like that, right? The pain is going to come back, and now you reach for that bottle of another muscle relaxer, or you go to the doctor for another prescription. The cycle just starts all over again. So despite the name muscle relaxers, they don't actually act on the muscle system. Rather, they work on the entire nervous system. And muscle relaxers are typically taken by people looking to decrease muscle spasms, tightness, pain, those sort of things associated with back pains, headaches, fibromyalgia symptoms. Follow me? But why take a prescription to relax your muscles when there are so many natural ways to accomplish that same goal, right? I think if there's a way that we can naturally do that and give you some relief, well then, hey, I think you should do that instead. So let's give you a little background and history of where muscle relaxers come from, what their symptoms or what their purpose was. So a muscle spasm results, number one, from inflammation that occurs when your muscle is overstretched or torn. It can even be micro tears. And the muscle strain doesn't sound like a serious injury, right? But it can actually cause severe pain for some people. And the more and more you have those muscle strains, the more it creates more scar tissue and more problems, puts you in the emergency room. But the more and more these happen, the more and more the pain gets more severe, all right? So when we look at muscle relaxers, they're a group of drugs that reduce tension, muscle spasms, and overall just have a sedative effect on your whole body. But those drugs are designed to depress the central nervous system. So there are 2 main types of muscle relaxers. There's spasmolytics and neuromuscular blockers. So the spasmolytics are most commonly used to alleviate pain associated with spasms and a variety of other neurological problems. Neuromuscular blockers are used in surgical procedures and are most often used in the emergency room to create like a temporary paralysis. And that's where you get the term muscle relaxer. Relaxant is commonly used for those spasmolytics only. But here's the thing. Due to the side effects, an initial assessment is required to evaluate if you even need that drug and for what length of time, which is required, which a lot of times never even happens. But the muscle relaxers are typically used to treat acute problems, not for long-term use. And individuals taking those muscle relaxer drugs definitely need to be under close supervision. But again, I'm going to teach you some ways you can avoid those things completely. And here's the thing. The earliest known use of muscle relaxant drugs dates back to the 16th century, back in Europe when explorers actually encountered natives in the Amazon using poison-tipped arrows, right? You ever seen that, like the Indiana Jones where they spit the poisoned arrow and it like knocks them out and they can't move their leg, or like Ace Ventura, Pet Detective, right? He gets shot in the arms and he can't move his arms. So that's where it actually stemmed from. But those like actually produce death, right, by the paralysis. And so this poison led to some of the early scientific studies of pharmacology and the ingredients. And well, now they are what they are. And now they're actually used in widespread pharmaceuticals. But by 1943, neuromuscular blocking drugs became established as muscle relaxants and used in the practice of anesthesiology and surgery, and the list goes on. So looking at muscle relaxers, you got to understand, okay, are they really addictive? Are they as bad as the opioids and other medications? And in the US, as well as other countries, they are very commonly abused. And the problem is that muscle relaxers can be so fast-acting and effective at that temporary pain relief that people with chronic pain can easily become addicted to these things. And the addiction often develops with the muscle relaxers when they're used habitually as the main or really the only source of pain relief. And the number of people winding up in emergency rooms because of misuse or abuse of these drugs is staggering. It continues to increase, and it's more than doubled in recent years, actually. And the things like the FDA, they recommend patients take muscle relaxers only for a limited period of times, like maybe 2 or 3 weeks. But again, these cause buildup effects in your body as well. And so we never want to put a poison into our body if we can avoid it. So when some muscle relaxers are ingested, they're actually converted by the liver into a chemical with anti-anxiety properties. So this means that even when you take it on its own, patients run the risk of a physical or psychological dependence on these muscle relaxers. And so similarly, when you use some pharmaceutical drugs, the body becomes used to a daily intake of these muscle relaxers, becomes dependent, and your body doesn't function normally. And then you skip a dose or you just stop altogether, you can experience the withdrawal symptoms. And these muscle relaxers can cause things like liver toxicity as well, and become more and more problematic. And then you combine them with other medications, and the side effects get even worse and worse. So one of the best things I do is like one of the homemade muscle rubs that it's like a DIY thing that I recommend for patients too. It not only will soothe your body, but it'll also soothe your mind, right? It'll make you feel all foggy. But you can do something as simple as taking a few drops of frankincense and cypress essential oils and mix them with a carrier oil like fractionated coconut oil, and even use like an unscented lotion and mix it in with that and apply it to the concerned area, and it'll help relieve that pain. It'll help decrease the muscle spasm in that area, and you don't have to have all the bad side effects of those muscle relaxers. Because when we look at the side effects, it's pretty crazy what kind of stuff is out there. I mean, they include side effects like drowsiness, dizziness, dry mouth, urinary retention, even the total inability to empty your bladder, which is going to lead towards infections, fatigue, weakness, and addiction. And they can even cause things like acid reflux also. But the more extreme cases, when you start to abuse these, I mean, they lead towards heart failure, paralysis. These long-term side effects can be really dangerous too, just in your daily use. If you're driving, operating machinery, you're putting other people's lives at risk also. I mean, it's serious about when they say like, hey, don't operate those things. Even if you feel under control, you're really not. And these addictions just start to spiral into other addictions to other drugs too. And so, conventional muscle relaxers definitely shouldn't be taken by older people, pregnant women. But again, if you see those, why would you want to even put those in your body if they're like, well, this person shouldn't have it and this person shouldn't have it and there's this medication. So let's get into some of the best natural muscle relaxers. So one of the best ones is arnica oil. It's Arnica. I might be pronouncing it wrong. I'm not the best pronouncer out there, but this is great. You can apply it to the skin in the form of an oil, cream, ointment. Has a positive effects on reducing pain, inflammation, and muscle damage. One of the things I really love too is just the chiropractic adjustment. It's a drug-free, you don't have to put anything on your body, surgery-free, just allows the body to naturally heal. But what it does is it's shown to be really effective in just reducing pain in the muscles and actually naturally relaxes the muscles because remember, it's affecting the nervous system, right? And so research from the College of Chiropractic at Life University and some other resources too show that that's super effective and it actually shifts the alignment in the spine, relieves the pressure on those muscles, and experience just that pain-free feeling that you want. Also, another good one is cannabis oil. So cannabis oil is really known to open up those pathways and is a smart choice for natural muscle relaxers. And if you do the right type of oil too, it's not going to have any type of hallucinogenic effects or anything, but make sure you just get it through a reputable company. I love essential oils. Peppermint oil is a great one. We talked about the frankincense and the cypress. Also, lemongrass oil helps improve the blood circulation to the areas to relieve muscle spasms and backaches as well. So you can actually do the frankincense, cypress, and lemongrass essential oil with that fractionated coconut oil, mix those together. That's a great way to do it. Obviously, I love massage too. That's a great way to get those muscles relaxed. A lot of research about that. And then also just avoiding the pain foods, what we like to call them. So avoiding sugar, alcohol, caffeine, trans fats, and just excess calories, right? From being overweight, that extra weight will just impact that as well. So really just try to stay away from those inflammatory diets that will just blow your body up with inflammation and pain and spasm. And then also I love Epsom salts and magnesium. So you can just soak in a tub of Epsom salts. It's a great way to help relieve the cramping and the muscle spasms and just help your body relax, reduces inflammation also. And so these are really great for the body and a lot of great effects for that. And then one thing when you're having these muscle spasms is don't get too much rest, right? When it comes to muscle spasms, especially when it's severe, it's a good idea to keep moving. Even if it's just a little bit, it's going to help keep fluid moving in your body, which is going to move the inflammation around so that it doesn't come stagnant. And so just daily activity, even just getting out to do a little bit of a walk is going to be better than just sitting around because the longer you sit around, the more pain you will have. So again, I hope those help. Hopefully you got some of those and you can start to apply those things. And in the end, remember, these are just reliefs, maybe some temporary relief. Some of those might be some fixes like the chiropractic, but make sure you get the long-term fix, not just a temporary patch. So until next time, remember, your body needs no help healing, just no interference.
Thanks for listening, and we hope you enjoyed today's episode. Please help more people in reaching their fullest potential and rate, review, and subscribe to this podcast. For show notes and other free resources we mentioned today, go to newedgewellness.com.